Dr. Sherri Onyiego, representing Harris County, Dr. David Persse, representing the City of Houston. Thank you to past President Kathy Finninger of Rotary Club of Houston. I am Stephen Williams, Director of the Houston Health Department. Our 44th show. What do you know about using the existing drug liptodepsin? We had that last week, but go ahead.
This is the one from the...
It's the only one that was left from last week.
Yeah, effects. So it's been used as a chemotherapeutic agent from what I understand. It does seem to have some activity against coronavirus, but I think there's a lot more that needs to unfold in terms of the data and how it can be used.
Yeah, the reading we did showed that it may be a very potent antiviral, but it may also have some side effects. So it can be really important to see what happens in the human trials.
I just learned we're supposed to stop taking acetaminophen, ibuprofen, prior to getting vaccinated. How long before, since I took the vaccine after taking an anti-inflammatory, will that reduce the effectiveness of my vaccine?
Well, I think theoretically, certainly with the anti-inflammatories, it could impact the effectiveness of the vaccine, but that's a theoretical concern. I would probably, if I was somebody who's frequently taking those medications, I would probably take my last dose at least 24 hours before the vaccine, if not more. And then the other thing is that afterwards, once you get the vaccine, if you wait for everybody else, if you get vaccinated and you wait until you start developing symptoms, what I've been told, and you tell me if you've heard anything different, is to still stay away from the anti-inflammatories, but a Tylenol, during the period where you're symptomatic, which is generally be at least 12 hours later, probably isn't going to negatively impact things too much.
That's
but
right.
The anti-inflammatories may.
Anti-inflammatories may, and obviously it's a conversation you need to actually have with your healthcare provider. But yeah, and the other thing to point out is that in the data trials, in the clinical trials, they didn't necessarily, have that. They didn't encourage people to actually do that. So that's another reason why we're not necessarily recommending individuals do that before they take the vaccine as well.
With many underlying conditions, would I be better off continuing to isolate in my home and not take a chance with the vaccine?
No, we would still recommend that you use the vaccine as an effective tool for prevention.
Let me go through some of this little back of the napkin math that I've been telling people.
Yeah.
So right now, if you take the number of people who've been infected in Harris County and you look at how many of them get hospitalized, it's about 10%. Now, you can reasonably argue that is a huge overestimate because so many people get infected and don't test and never get diagnosed, right? So let's take that 10%, let's cut it in half, make it 5%. Tell you what, let's cut it in half again and make it 2.5%. Tell you what, let's cut it a little bit more to 2% just to make my math easier. So 2% is a 1 in 50 risk of if you get infected requiring hospitalization. If you also look at the number of hospitalizations, the number of hospital deaths, that is a 10% ratio. So if I get infected, I'm running a 1 in 50 chance of getting hospitalized and a 1 in 10 chance of then dying if I get hospitalized. My risk with the vaccine, apparently right now getting an anaphylactic, the severe allergic reaction, is 1 in 200,000.
Well,
Yeah.
All right, so you know what? I'll take my chances with the vaccine.
if the vaccines are created in mass quantities, what makes a particular lot cause more allergic reactions? Does it depend on its manufacturer? I've never heard that before.
Well, there was the one lot of the Moderna vaccine where in a nursing home, there were a bunch of people who had problems, and they thought it was related to it. And my last understanding of that investigation was that it was not related to the lot.
It wasn't related.
Yeah, and I guess just to keep in mind that they're all going through the same manufacturing process. The lots are sort of both based on the manufacturing process. So they're not specifically pulling out one lot versus another. They all have the same chemical component lot to lot to lot. So I haven't heard of any additional reports beyond what you've mentioned either.
Okay. What is the total weekly number of vaccines being distributed in our area, including city, county, hospitals, pharmacies? Do we have a goal? Somebody asked me this question a couple of days ago. I looked at 2 weeks in a row at one point. It was like 42,000, and then the next week it was 52,000. And probably, if we looked at this week and last week, it's probably more than that because we got a little bit more vaccine. And we've talked about a goal of actually having about, 52,000 doses being delivered a day.
Yeah,
So
we have.
we're doing in a week what we want to be doing in a day.
Right.
I know several people who have had no reaction to receiving the vaccine. Does this have any connection to how well it is working?
I don't think so.
No. I mean, I think that we've talked about this before. Just keep in mind that typical reactions that people may experience, because again, this vaccine is reactogenic, so we're going to anticipate some sort of mounting of an immune response where people may have fever, they may have fatigue. So those are common effects. But certainly, if you don't have those effects, it certainly does not mean that the vaccine is not effective in you as an individual either.
Okay. A week after receiving the vaccine, my arm swelled. Any idea when we can stop expecting to see reactions? It's a little long, isn't it?
Sure, that's a little long, right?
Yeah. So I mean, typically we'll see, again, injection site soreness and tenderness can happen. That's common, but certainly if it goes beyond, well into a week, that's something they definitely need to probably seek
Be afraid
some
they've got an
advice
injection
about.
abscess or something.
The White House COVID response team said they have boosted financial support to cities. What can Houston expect? Actually, because we're a directly funded city, we've already gotten an increase in dollars for our expanded expanded laboratory capacity grant. I think that's around $100 million, and immunization about maybe $20 million. Right now, we're trying to figure out exactly how that money could be used, because when we first looked at it, significant amounts of that first grant were supposed to be used in the laboratory.
When you say figure out how it can be used, you're referring to what rules come with it,
Well,
not what do we want to spend it on, but what are the rules that come
Yeah,
with it?
what are the rules? I know there are a lot of ideas of how people want to spend it, but unless we want to pay it back, we better follow the rules and deliver too. That's the other thing. The state is actually getting, I think, $1.2 billion. And hopefully we'll be able to access some of that money too. One of the curious things about that is that they said that it could be used for quarantine and isolation initiatives, and we have a project that I've been wanting to do for years. I'm hoping that we can pay for it with that. Someone posted on Facebook that TSU was giving free shots on Tuesday and Wednesday of this week. While I'm glad, I thought it was a fraud because it said they were free and no appointments or age minimums were required. Y'all don't like that, do you? This is very frustrating with the lack of coordinated and accurate announcement. Who's controlling the messages? Let's deal with that age limit deal. Come on.
Yeah, I mean, the age limit is pretty clear. Those are the guidelines that have come from the Department of State Health Services. Obviously, we know that individuals 65 and even what they're calling super senior, 75 and above, are disproportionately impacted with higher cases of increased morbidity and mortality related to it. And so that's really some of the basis as to why that age group was even selected and highlighted, as well as the list of chronic conditions. So I think that is a really good point about making sure that the message is concise and that it's clear and that it's consistent across the board.
Thank you for joining us for COVID-19 Talk with local health authorities. We'll be right back.
With coronavirus spreading, people at higher risk must take extra precautions. You are at higher risk if you're over 65 or if you have an underlying medical condition like heart disease, chronic lung disease, diabetes, or if your immune system is compromised for any reason. If you're at higher risk, stay 6 feet or 2 arm lengths away from others. Better yet, stay home if you can. The choices you make are critical. Please visit coronavirus.gov for more information.
Learn to cough and sneeze with your pal Grover. Step 1. Realize you're about to sneeze. Step 2. Move your elbow toward your nose and mouth. Step 3. Gesundheit. 1, 2, 3. Remember to cough and sneeze into your arm or elbow and not your hands.
Welcome back to COVID-19 Talk with local health authorities, sponsored by the Rotary Club of Houston. With the new Uber Walgreens Great Community deal, after appointments are confirmed with Walgreens, the patient is supposed to receive an email to schedule a ride. When will their vaccinations be available? I think that federal program was supposed to start actually today, I think.
Yeah,
That's the word, but we don't know. I mean, things change often. Only 17% of U.S. school districts are fully open for in-person learning. A McKinsey study said that by the end of the year, white students could be 4 to 8 months behind, and those of color 6 to 12 months, often because they are also caring for younger siblings. Some schools are not worried about grades. Should parents, rather than schools, make the decision to have kids kept back a year? Several parents asked about the academic and emotional impact. Any comments?
Well, I think that the only comment I have is that it is important that we get kids back into school. And the way we do this is what we've been saying all along, is we got to get the pandemic under control, which means every single individual has got to do their part.
Yeah.
Elementary and middle school seem to be safe. What are you hearing?
Yeah, I mean, I think that that's consistently something that we've kind of known about from the very beginning, that it tends to behave differently with younger kids. And older kids tend to sort of respond to the virus almost like adults. And so I think, again, going back to your point, is, we have to really hone in on those mitigation strategies inside the schools to ensure that they're safe and they're creating safe environments for not only the kids, but also the staff and the teachers, so that the kids can continue on with their education. We do also know that there are also extracurricular activities that also create high-risk opportunities for the virus to spread as well.
Are plexiglass barriers in schools working or just there for perception?
I haven't seen any good studies,
Yeah.
but what I will say is the classroom seems to be a pretty safe environment, but keep in mind, you've got an adult there sort of riding herd on the kids to make sure that they wear their masks and distance stuff. And the other thing is that you do have reduced class size because not as many kids. So in our experience locally is that the schools that have got more kids attending school are the schools where we've got more problems. So there's a cause and effect related. So the plastic barriers are probably helpful. But they're not the answer. There's no one thing.
They're not the answer. I think to that point, they definitely kind of at least create a deterrent. It does create that physical separation, even in other settings where you see the plexiglass barriers. It certainly has people to stop and to sort of make sure that they're minding the distance and the barrier. So I think that is at least an effective strategy in some parts.
With the new variant, have tests changed to make an accurate diagnosis?
I don't think we're missing any. I don't think we're getting any false negatives because of a new variant, are we?
No, but I would just say that I think that that there's not enough genomic testing that's happening to be able to identify the variants, and I think that the CDC has definitely come out over the last few weeks more aggressively saying that testing is going to start happening more and more and more, so we'll be able to accurately identify more of these variants. So I think that just as a country, we just weren't testing enough specifically for the variants.
Frequent tests appear to push the positivity rate down in some locations. Does that agree with what you have seen?
I would not say so. When we look at our graph, we see that in the July surge, we saw an increase in people getting tested, the parallel an increase in people getting hospitalized. And I think that was as more news got out, more people went to get tested. They heard the message, they went out and got tested. But it was still a percentage. And then with this later surge, the same thing is more people, were worried about the holidays and hospitalizations were going up. So we've got in comparison, we got a lot more people being tested today than we did back in July, but it's still a percentage. And so I don't think that more people getting tested drives the percentage down. Because remember, the other thing there's still 40% of people, give or take, are infected and don't even know it.
Right.
So I don't think it impacts it, no.
Can I be contagious longer than 14 days?
You can, yeah.
Yeah.
If you're immunocompromised.
Community numbers are still appearing high. What is the latest for the city and county?
I mean, for the city, for the county, our positivity rate is still hovering around 16, 17%. So again, although we're coming down, it's still at a high rate, and we certainly don't want people to let down their guards.
Right.
The new CDC director recommends a cloth mask over a disposable one. Do you agree?
Yeah.
Yeah? Okay,
Yeah.
both of you are wearing 2 masks. Talk to
Yeah.
me about that.
And we had this conversation this morning
This
as
is one, yeah.
well. So I think that one of the things that there's definitely some science behind it, and obviously we've talked about the fit being important. We've talked about the proper way to wear the mask being important. It has to cover the nose, it has to cover the mouth, and it has to be enough layers there to offer that
And
effect.
it needs to fit
Yep.
tight.
Yep.
Yeah. But to reinforce one thing you just said, which I think that the public can hear, it has got to cover the nose. This under the nose thing is just ridiculous.
Yeah, I know. I went in the grocery store last night and I saw this guy walking around with one under his nose, and it really bothered me. I felt really kind of icky about it because it was surprising, because I'd gone in the store, often, and I'd never seen anyone without a mask that wasn't worn properly. There have been some cases of airborne transmission, such as the Australian quarantine hotel, where guests in different rooms on the same floor contacted the new UK strain. Air handling systems and the natural flow of the air in multifamily buildings might be the cause. Is this high risk enough to worry?
Yeah, I mean, I think it is concerning. And I think that's part of one of the reasons why you're seeing a lot of the recommendations, especially with wearing proper masks, to really look at that and to offer those recommendations to combat that.
I know that whenever we look at a special event, one of the things we look at is the air handling. And how does that building manage the airflow?
Per the Times of India, there are 7 new symptoms being seen. The new ones aren't typically mentioned are sore throat, conjunctivitis, skin rash, discolorations of fingers or toes. Other sources talk about strange new symptoms began seen with swollen toes and enlarged tongues. How common is this?
So those are symptoms we've heard about.
Yeah.
In fact, there's a term, COVID toes.
COVID toes and COVID tongue.
Yeah.
Yeah.
They're not common.
No, they're not.
Yeah.
They're not common. And I think one of the other things, too, to keep in mind is that as we have this new generation of people that are going to be going into healthcare, medical students, the whole bit, these are going to be brand new chapters that are going to be written about this. And so we're still finding out so much about it. But yeah, in terms of the commonality of those symptoms, they really haven't been reported as very common.
If you've contacted the virus, even after being vaccinated, do you experience typical symptoms?
Well, theoretically, if you've been vaccinated and you still contract the virus, theoretically you would have lesser symptoms. Theoretically.
Yeah, because keep in mind the vaccine has been shown to be 94% and 95% effective against severe symptoms. So those are symptoms that can put people in the hospital.
Right.
Or, and potentially have worse outcomes like death. So yes.
Thank you for joining us for COVID-19 Talks with local health authorities. We'll be right back.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
I'm Carlos Correa.
I'm Smubhouse.
I'm Slim Thug. I recovered from COVID-19. Protect yourself and protect your loved ones and mask up.
I want to encourage everybody to be a team player and mask up.
Mask up like a champ to protect yourself and everyone else.
As we reopen our city, it's important that we do it safely. Continue to wear your mask in public.
Wear it like an all-star.
Wear it like a champ.
Wear it like a boss.
Remember, we're all in this together. Mask up, Houston.
We are in this together now. Now we have the tools to overcome this challenge. social distance, wash your hands, get tested, and wear a mask. And we will, I have no doubts, because I believe in we, better together.
Welcome back to COVID-19 Talk with local health authorities. We'll be right back. Methodists announced the South African variant has arrived in Houston. Will this alter anything we're doing? Please explain what the wastewater has shown about the variants.
I'll take that one. So the South African case is actually in Fort Bend County, so it's a Fort Bend case. And it actually was quite some time ago. It was in December. And the sequencing is just we're ramping up, and to your point, we're ramping up the amount of sequencing we can do to identify variants. So it doesn't really change anything at this point. I talked with Dr. Minner, we talked to her this morning, and they have reason to believe that that individual, based on what he did and the signs and symptoms of his family members, that it may have just stayed with him.
Right.
So that keep our fingers crossed that's good. But he's just the first. There will be more, right?
Right.
And you know, it's so ubiquitous now, we just are going to have to, you know, we'll try to, the question is how quickly can we identify a new variant in the community, and that requires sequencing, and that is just getting ramped up now.
Okay. South Africa halted use of AstraZeneca vaccine that does not seem effective with the strain here. Does that impact trials for other countries?
Yeah, I mean, AstraZeneca's South African trial was stopped because it did not show promising results against mild to moderate symptoms. And so certainly that does seem to, you know, we do need to look at that and be careful and pay close attention to what that impact that has across the
that same vaccine was also being used in the UK and in the US, and it was showing, it was, you know, the preliminary was looking like it was being effective, but not against the South African variant. So.
Okay, this is a similar question. Multiple sources note the UK strain will probably be dominant by the end of March. Is it true that the current two vaccines are doing well against it, perhaps only 5% less efficacy?
Against the UK variant? Yeah, I mean, from what we know right now, the vaccines that Moderna and Pfizer seem to be, don't show any limitations.
Yeah, no, we're getting that from the manufacturers.
True.
I've not seen that in a peer-reviewed journal yet, but yeah.
Okay, the Jerusalem Medical Center has a treatment using Allocetra, a drug dealing with
cytokines?
Yeah, thank you. That has 95% success rate with most fully recovered in 5 days. So
I can just tell you a little bit what I've heard about that one. So it's limited studies right now. I think they've only tested it or used that treatment in about 20 patients or so. So certainly a very small number. So I think that one of the things that we just have to, again, keep in mind, just like we talked about the other therapy earlier, is just see where the, you know, how that translates across as more and more people, as more people are, you know, utilizing that therapy. But I think right now we still have to just wait and see, because I think they just utilized it as a phase 2 in Israel. But with that small sample size, I think it's hard to make.
You know, one important thing I think that you bring up that people need to understand is that when these new things come, very often the initial studies looking at less than 100 people can show really great results. And then when you actually do the large one, tens of thousands of people, find it's not really so great. So there's a, you know, there's a huge variability when you look at small numbers. Conversely, sometimes these things look, and they don't have a whole lot of benefit, and then when you get out to the bigger studies, they find that they actually do have a big bang. So these really small numbers, you really got to be careful how you interpret them.
Let's come closer to home. An announcement was made about a new community vaccination center at NRG starting February 22nd. Will that be incorporated into your current waiting list, or do we start over? How is equitable access being ensured for those making appointments? It still looks like those who can pounce quickly on the internet will succeed. You want to take a shot from the county perspective first?
Sure. So I do think that it's hopeful that we're seeing more resources come to the community. I do know that this is going to be a federal sponsored project that they're going to be doing in collaboration with the state as well as the locals. So we do have the county wait list that's in place right now, and it's been pretty successful. I think at this point we have over 300,000 people that are on that wait list, and so certainly that is an opportunity to utilize that wait list to be able to pull from people to be able to take advantage of this resource.
Yeah, what we're really looking at is possibly a unified command between the city and the county. I know that there has to be some assurance that we're actually putting people from both jurisdictions, although I'm sure with the 300,000 people you have on your wait list, a number of those folks are inside the city of Houston. Really, we're having a meeting sometime today to talk about the details of how this is going to be done. And in terms of equity, in my opinion, I think the large sites are really good for getting the numbers, but when you start talking about access and equity for all folks, you have to have a more intentional approach for certain neighborhoods.
Yeah.
Nasal spray is it?
Can I just
Zero?
go back to
Go
that
ahead.
point that you were saying?
Yeah.
So in terms of the equity, I think that I think just to add a little bit more to that, I think that we also talked about that this morning. It's part of how we can also, engage our other stakeholders in the community too, whether that's faith-based sectors, federally qualified health centers, things like that. I think that that's really a great way to truly penetrate it into areas where individuals truly who need that access can get it.
Absolutely. As a matter of fact, we're working with Harris Health and their Gulfgate Clinic this weekend from an equity and access perspective. Two more questions. Nasal spray XLEAR is seen to reduce the severity of viral infections, including COVID. Y'all heard about that? Just from your expressions. I can read your eyes now, you know that.
You can read the blank stare in my eyes.
That one I'm not familiar with, yeah.
Yeah. I was reading her though, because I said, she don't know what that is. Okay. UC San Francisco lab is using nanobodies to immobilize SARS.
Okay.
Is that a blank stare?
That's a blank stare.
That's a blank stare, too.
Okay.
Yeah.
For those of us older residents, do you have antibodies already that could fight coronaviruses?
Yeah, I don't think so. No, so coronaviruses have been around for decades. There are three that cause the common cold, but clearly, and all of us have certainly got, or the vast majority of us have got antibodies to those common cold ones, and they clearly have had no impact on SARS-CoV-2.
No.
So, unfortunately, no.
So there are antibodies to the common cold.
Yeah. Now, one of the problems with those antibodies to the common cold, and this is one of the concerns about coronaviruses as a whole, is that the reason you keep getting colds over and over and over again throughout your life, and I'm like a viral magnet. I get 2 colds a year like clockwork. So I don't maintain much immunity to the coronavirus that causes the common cold. Remember, to keep in mind, there are many different viruses that cause cold symptoms. Some of them are coronaviruses,
Right.
but they are very common in the United States. And I'm sure I've been infected with the same one multiple times in my lifetime. So I don't get lifelong immunity to that coronavirus from infection.
That's very insightful. Thank you for joining us with COVID-19 Talks with local health authorities. With us representing the county is Dr. Sherri Onyiego, Dr. David Persse representing the city of Houston. Thank you to past President Kathy Finninger of the Rotary Club of Houston. I'm Stephen Williams, the Director of the Houston Health Department. See you next week.